Good morning, East Brunswick. It's Thursday, March 26, 2020, and a lot has changed since the last time I gave you an update a couple days ago. I believe that was Friday the 20th. And so just to keep you updated with what's going on, as of this morning, East Brunswick has a total of 21 confirmed cases of coronavirus. And those cases, as I told you earlier, and as we all know, will continue for the foreseeable future. Most of that comes because of the fact that we have more people getting tests now. And as we've also spoken about, there is the largest cases, 4 out of 5, are all coming from the spread of disease from asymptomatic carriers who they themselves either don't know they have it or have mild symptoms and again, don't know that they have it. So that's really the main reason for all of us being home and working from home. Sadly, though, I do have to report that we did have our first death from coronavirus from an East Brunswick resident. He was a 65-year-old male, and we all mourn the death of anybody from this unfortunate crisis, and pray for him and his family on this unfortunate loss. As far as the municipal updates are concerned, there are a couple of changes, like I said, from Friday. As you know, we are now down to a statewide shutdown, which started on Saturday night by executive order from Governor Murphy. And now that mandate is very specific. It lists which businesses needs to be shut down and which are considered to be essential versus non-essential. That list is on our East Brunswick website. That can be viewed at your convenience. Each one of those executive orders are found there. They are updated as new ones come out. In some instances, there have been additions or clarifications of the executive order, as people often question what is essential, what is not essential, or what may they, which of the businesses are not really clear how it's written. And so in order to clarify anything that they don't understand, the governor has issued continuous updates. All of that is on the website. Our municipal building remains closed. All essential staff is in the building, and all essential staff that needs to be here will be here, but everybody else is working remotely. All of our departments are available by phone, they're available by email. Sometimes there may not be an answer right away, but we're taking messages. You will get a call returned to you. If not, just call back. But I promise you that the municipal government is still working. Our recycling center is now closed. This is deemed to be a non-essential service, as we already have a mechanism in place for picking up garbage through and recycling through our contract with Solterra. And so garbage and recycling pickup schedules have not changed. Expect that to continue for the foreseeable future. If you have a particular problem that needs to be dealt with, feel free to call DPW and they can make arrangements with you on an individual basis. Our parks remain open, but our courts, our fields, and the playgrounds remain closed. That's because we do find that in many instances people were congregating, or as in playgrounds, the general idea is that for people, it's there for people to congregate, which we're looking to not allow. We have seen people that were breaking, climbing over fences and breaking through fencing. That's not going to be tolerated. The police will enforce that. If we see anybody that's breaking the law, playing on fields, we will issue misdemeanors and summons, which will be enforced. I have fortunately seen a lot less of that in the last couple of days, so I'm hoping that people are taking this shutdown seriously and staying at home. Several of our members of the senior center have continued to call asking about when the center is going to be open. They have heard from the news, as high in political office as you can get, that things are going to be back to normal by Easter. We are going to go by the science. The state the county and the municipality is going to let the science dictate when it's safe to open any of these facilities. So for the foreseeable future, the senior center remains closed. And just as a caution, generally those places that were closed first were the ones that we feel are the people that are the greatest risk for illness from coronavirus. They will probably be the last places to be opened. But for the foreseeable future, that center, along with the entire municipal complex, is closed because they are, in anybody that's not considered essential, we are following the governor's directive like everybody else, and they will remain closed. On the flip side, any essential service remains open. So all emergency services and any services in the township deemed essential will be open and will remain so. Please look to the township website. We continue to update that as a large section on coronavirus. And that site's filled with information and links to things such as restaurants that are open for takeout and delivery. They also have links on that to menus and to means of paying through credit cards, so you don't have to use money. There's links to grocery stores, which list their accommodations for those who are seniors and those with disabilities so that they don't need to shop with everyone else. There's links to many government sites, including the New Jersey Department of Health, the CDC, the WHO. State sites have a lot of information for businesses in order to help them either with business loans or for individuals who are looking for information on unemployment, and many social services that people seek at a time of a crisis such as this. There's also information for those that are renters, for those who may be in foreclosure, to make sure that you have opportunities to get linked to places in state government that can help you never be put out in a situation where there's a crisis. All of those links are on that website. It also includes township or community-driven programs that are providing assistance. Now, I'll talk about them in a little bit, but they will include the Blue Delivery program scheduled to start on Monday. Brunswick Memorial Home has a volunteer match program. They have all of the EBTV tapes about previous updates that have been provided. And there's been an incredible outpouring of community support during this crisis, and that's really very uplifting. And like I said a couple seconds ago, some of those include, for instance, our Blue Delivery program sponsored by the East Brunswick Police Department. What they're doing is they're making arrangements with ShopRite of East Brunswick for seniors or those who are caring for people with disabilities or those with illnesses for which they have no other means of getting out and picking up groceries. What this is not for are individuals, perhaps seniors, who can drive. There's no reason that they can't go to ShopRite at the hours or any of the other Stop and Shop, any of the other stores, all of whom are providing opportunities for them to shop at times when they're not out with the general public. This program is specifically for individuals who have absolutely no means of being able to pick up groceries. And so we're going to try to be as forceful as we can and not allow for any type of abuse of a good program meant for people who have no other options. Brunswick Memorial Homes has always been a great partner with the township, put together a volunteer match program. And what they're doing is they're matching up individuals who are willing to volunteer for anything in town that's needed during this crisis with individuals who have specific needs. And it's been extraordinarily well received, and again, a program that provides help for those that need it. But please, again, don't look to take advantage of people's goodwill. People should be requesting help who really have no other means of being able to get it other than through this volunteer program. The East Brunswick Chinese community, I mentioned it earlier, and it was already posted out on social media, raised about $17,000 in several days. They were able to provide the township with much needed PPEs and N95 masks, which we donated off to the hospitals, and $2,500 in gift cards that could be used to any of the grocers in the area. And so our Parks and Rec department will be very shortly coming out with a way in which people can call or ask for support through those cards, and we'll distribute them to the people by basis of need. And as I mentioned earlier in the last update, I'd like to shout out to several other organizations or groups in town who have volunteered to help. And what we're doing with those is I'm kind of keeping a list of them right now, because for the most part, we're in a pretty good place in terms of servicing those people with needs. But I have no idea, nor do you or anyone else, on how long this crisis is going to go on and the order to stay in place continues. And as it goes on for days and weeks ahead, there may be needs that we don't know about now that come up in the future. But I do want to give a shout out to those who have volunteered to help when we feel that it's necessary. These include Aldersgate Church, the Islamic Center of East Brunswick, the Anjuman Burhani Mosque on Dunham's Corner Road, St. Mary's Coptic Church, Cornerstone Christian Church, all three of the East Brunswick synagogues, the Brunswick Square Mall, Carrie Teifel from TFE Properties, that's the properties that own Kmart. They're offering their facility in the event that the state needs it. We also have many other companies that I don't want anyone to feel slighted if they weren't mentioned here, and hundreds of individuals who have all offered help during this time of need. It really is overwhelming and appreciated by not only me, but everybody in the community. When it comes to economics, and I've got a lot of questions when it comes to mortgages and township taxes and utility questions about bills and whether or not that's going to be deferred, I'm going to save that entire subject to a future East Brunswick TV tape. Because as we sit here right now, the state and federal government, they're still working through those needs. The Senate just last night, most of you have been watching the news, passed a $2 trillion package for relief. That still needs to go to the House, needs to be signed by the president. It's a whole process. And the state itself is looking to get a handle on the effect that the crisis is going to have. And a lot of that depends in large part on the length of time that we need to be shut down. So as we get a little bit more information, I promise that I will be back and devote an entire segment to just the economics. Right now, we're still concerned about the healthcare impact of this crisis. And speaking of the healthcare impact of this crisis, there's been a lot of talk about the drug hydrochloroquine, which is generally used, and before all the coronavirus stuff, for people with conditions such as lupus and rheumatoid arthritis, still used for that. And there are trials underway to see if it's effective for the coronavirus. The studies are still underway. It's not been determined yet through any real clinical evidence-based studies whether it's that effective. But what I've seen in the meantime, unfortunately, is a run on prescriptions for these products to the pharmacies. There's massive amounts of people who are trying to stockpile this drug. And what it ends up doing is it, one, prevents there being a supply for the people who have needed it all along with the conditions that I mentioned earlier. And it also makes it difficult for hospitals who may be using it on critical patients to get that supply. There's no real need for it. Nobody should be hoarding this medication, and doctors should not be prescribing that for patients that don't have a clinical reason for needing that medication. So I caution people not to ask, and I caution my physician colleagues not to prescribe it unless people fall in the specific classes for which there is a need for that drug, or for hospital physicians that are using it on the front lines for people that already have coronavirus. Please. Regarding N95 masks, there's also been a report. Some of the hospitals are reporting that there's counterfeit masks that are being brought into the hospital and donated, and that's no fault at all of the people who are donating these masks. But there is a big problem. The hospitals do routinely take donations, and they do need to test the N95 masks to make sure that they actually are capable of preventing spread of the virus to the healthcare workers who are using them. So what I'm asking for is continued reach to those of you who are homeowners. You may have in your basement or in your garages N95 masks that you weren't aware you even had. Contractors, painters, other people who use these for their professions may actually have them. So if you do, we're asking you to continue to voluntarily turn them into the police so we can bring them to the hospitals where the healthcare workers who need them can use them. All you need to do is bring them to the front desk at East Brunswick Police Department, which is the only entrance to the municipal building that's open. And we'll gather them and bring them or ask for them to be picked up for the hospital. Look, we're going to get through this. We're going to get through this together. I promise. What we need to do is we need to stay strong. We need to stay connected. We're fortunate that we now live in a world where we do have the technology to allow us to stay connected, even though we may not be in the same room or the same space. And we need more than all and more than anything to stay safe.